my name's Steve Drabeck, and I'm with Idaho Fly.
Hi, I'm Chris Preston, also with Idaho Fly.
We have a third in a series of videos discussing cancer, and we have Dr. Kuntz, who did a video or did a talk on testicular cancer, and has a lot of good information about how this cancer impacts especially the younger generation, men average age of 25, 30, and how this can cause a lot of problems with them, but is also very curable.
A lot of great information in this video that you should be sharing. So if you're a mom, a wife, a girlfriend, please share this with the men in your life. This is a disease which you can be found with self-examination and then easily treated, and the success ratio is in the high 90s, as you'll hear Dr. Kuntz say in the video. So this is something worth sharing to all the men in your life. Thanks very much. Hope you enjoy it.
Thank you.
So my name is Dr. Nicholas Kuntz. I'm one of the urologists here at Idaho Urologic Institute in Meridian, one of Idaho's leading center for all urologic care in the Treasure Valley. I've been tasked today with discussing a topic that is pretty relevant to my field, that is testicular cancer. Turns out April is Testicular Cancer Awareness Month, so this talk may seem somewhat fitting for the time that we're in. And I guess I want to start by just covering a few of the basics regarding testicular cancer. Number one, it affects primarily young men. So the average age at diagnosis is going to be around age 30. And it's the most common non-skin malignancy, solid organ disease that affects young, healthy men otherwise. So it's relevant in that early diagnosis and early treatment can affect the long-term outcome and survival. So when you're talking about young, healthy men, you have a lot of years of life ahead of them. So early diagnosis and early treatment is going to be relevant. So some things to take in mind. Number one, this is almost always asymptomatic. Doesn't usually cause testicular pain, and it's identified during self-examinations. Very rarely am I ever doing an exam for another reason and I stumble across a mass for whatever reason. So the vast majority, I'd say 90% or more, men are doing examinations at home, either in the shower. They feel something that doesn't feel quite normal. They then see their primary doctor, who then also would confirm that and then send it to us for further evaluation. So if you know someone or you've detected something that you don't feel is quite right, it's very easy with either examination or other diagnostic testing to diagnose this. The main method that is used for a testis mass is going to be a scrotal ultrasound. That gives us very clear imaging that is almost diagnostic for a mass. When we see something that's abnormal, that's arising from the actual testicle, that from my standpoint, that is a malignancy until I prove that it's not. And so we take that very seriously. So if on self-exam you notice something that isn't quite right, I would encourage you to seek further evaluation. If it turns out to be something besides that, there's literally no harm to an ultrasound. The cost is minimal. There's no radiation, but we can get a lot of good diagnostic accuracy with further testing. So let's say you've already been evaluated for this and someone's told you have a testicular mass. So then what? So the vast majority of these have to be removed surgically. It's a surgical disease, so you have to remove almost always the entire testicle. There are certain cases where potentially you only have one testicle, where we can do organ preservation, so remove just the mass and leave the testicle behind. But that's the very few exceptions of cases. So the vast majority, this will result in loss of the entire testicle. So that can be a big blow to some men who are otherwise perfectly healthy, and then you tell them all of a sudden, hey, we're going to have to remove your testicle. The good news to that is for early diagnosis, with that treatment, the cure rate is very high, upwards of 98, 99%. So the vast majority of men with a single operation, which is outpatient, takes less than an hour, can be cured. There are other cases that are not cured with that single treatment, and that gets a little bit into the weeds of secondary treatment options, whether it be chemotherapy or radiation. There are certain cases where that may be indicated. But the very first step in terms of making the diagnosis will require surgery. After that surgery, the pathologist will look at that specimen under a microscope, and then they will categorize certain types of testicular cancers because there are differences. And that is also related to recurrence patterns. Some testis cancers can come back up to as high as 50% may recur at some point down the road. But on average, that is somewhere probably between 20 and 30%. So after the initial diagnosis, after surgery, there will be another discussion regarding prognosis depending on what that pathology shows. And like as I mentioned, there may be indications where, hey, we want you to meet with a medical oncologist, a medical specialist that delivers radiation or delivers chemotherapy, versus a radiation oncologist, a medical specialist that delivers radiation. And there are specific instances for that. So some questions as we get often, right? We just got a diagnosis, hey, we think you may have a testis cancer, we need to move your testicle. For someone in their 20s or 30s, the questions that come up, well, hey, what is this going to do to my sexual health, my erections, my libido, my fertility? Am I going to be able to have kids down the road? And the answer to that question really is, most men were born with 2 testicles, and fertility is really minimally changed with removal of one of those. And so fertility rates go down by a negligible amount, should not impact fertility at all. Other sexual health, libido, erections, and those things also should not be impacted whatsoever. Now, there are cases where adjuvant treatment, so things like radiation or chemotherapy, that can impact fertility. And so that's where the question of sperm banking, there are reasons if subsequent treatments are not curative, or initial treatments are not curative and subsequent treatments are needed, then sperm banking may become important. The other issue that we sometimes get is, can you give a prosthetic or an implant later? The answer to that is yes. It's usually not recommended in the same setting when we're doing a cancer operation, removing the testicle. But down the road, if for a cosmetic reason or personal reason, you just say, I want a prosthetic to look like there's 2 testicles there, that is an operation. It's very easy to do. So that can be done later. So I guess to summarize some of the main points. Number 1, although testicular cancer is not common, right, it does primarily affect young, healthy men, and early diagnosis with screening, self-examination by men at home on their own is important. And with early diagnosis and early treatment, the vast majority of these are curable at early stages. In addition, even if cancer has spread outside of the testicle into some of the lymph nodes, those cases may require more treatment, either surgery or radiation or chemotherapy. Even at that stage, they're also highly curable. And so those treatments may have some impact in terms of morbidity and long-term function, but this tends to not be a lethal disease. So early diagnosis, early treatment, minimal long-term morbidity in terms of long-term complications and side effects as it relates to sexual function, fertility, but it's something that the general public just needs to be aware of because early diagnosis and early treatment are going to be key. In terms of risk factors, hey, how would I know if I might be at risk for this and maybe need earlier screening or earlier checkups with the urologist? The vast majority of these are completely sporadic, and so they occur randomly. If you have a family history, so a brother or father, uncle, then you may need to be more cautious and start screening earlier. Or if you've had a procedure as an infant, maybe one of your testicles wasn't descended, and that might be something you need to even ask your parents about. Hey, when I was an infant, did I ever have any operations for that? Those are the 2 most well-defined risk factors, but otherwise the vast majority of these come in with no pre-existing risk factors, and they're discovered incidentally. So those are the main talking points I would have. Number 1, not something to be overly alarmed about. I think any new cancer diagnosis is going to be a major life stressor, anxiety-provoking, And there is an information gathering phase where, hey, we need to wait for some diagnostic testing. There are some lab works that are going to be relevant. There is some x-rays and further CT scan to finish clinical staging. And those can be done in sequence, and there's limited amounts of information we can give right away. But within that first 2-3 week period after surgery and after those tests are done, the vast majority of men are diagnosed in an early stage, and the prognosis can be quite good. Statistically speaking, without looking at the data most recently, I want to say, I would have to check the most recent database, but it's not overly common. I mean, in our practice, I may see one a month. When I worked in the military, which is all young, healthy men, we would see more than that, maybe 4 a month. Per thousand, it might be in the 5 to 10 per thousand incidence rate, but I wouldn't. Yeah, you'd have to quote me on, or don't quote me on that. And so it's not like people are showing up every day, type deal. In terms of malignancies that affect men, prostate cancer would be certainly higher, which affects later generations. But if you look at the peak incidence right around age 30, that's what makes this, there's not so many health issues that affect young, healthy men. So this is important for that reason. And, most people, when they go see the doctor, I'm having this problem, you're not getting a testicular exam. So it's picked up by the patient, right? So we haven't seen, when hospitals closed, when doctors stopped seeing patients during the early 2000s until more recently, certain screenings went by the wayside: colorectal screening, breast cancer screening, prostate cancer screening. And during that period, we have since seen increasing risk of high-grade disease that have been missed from screening. We haven't seen that with testis cancer because most of the screening is done by individuals at home. So I think the public health message to be aware of, hey, there are things that impact young, healthy men, and they can be problematic if they're delayed. There are some old studies that have suggested there is, on average, about a 9-month delay in diagnosis where men have detected something. Hey, that's not quite right. That doesn't feel normal. That wasn't there several weeks ago. And then it's put off for whatever reason, on average for 9 months. So certain cases have been much longer. And when you see someone with a 10 centimeter testicular mass that didn't grow overnight, that's something that's been there for a while. And so whether it's a reluctance for whatever reason to seek medical care, that delay sometimes can be problematic. And so when these things are caught at 1 centimeter, 2 centimeters, 4 or 5 centimeters, they're highly manageable. Later on, they may require more treatment. And certainly if you can avoid chemotherapy and the toxicity of that, that's good. They are still highly curable, but when you require more toxicity, the long-term risk of that starts to get higher. In general, men's health-related issues, so erectile dysfunction or anything related to that, urinary problems, as well as things that impact the testicles. People probably aren't very open about it. So I guess if you have been, if you've experienced testicular cancer or known someone that has, whether in your close circle of friends and certainly family, be willing to express just the importance of self-examinations, and then just the importance of seeking medical attention if you detect something that's abnormal. It's not something to be ashamed of. It's certainly something I deal with every day. It's not embarrassing, and it's not taboo by any means. But I can only have an impact in cases that I know about, and certainly my experience is in the surgical management of this. And until it's brought to our attention, we just aren't able to have that degree of impact, which is hard for us, and more treatment and outcomes will deteriorate with that. So certainly something, if you're hearing about this today for the first time, would definitely recommend speaking with other men in your life, whether you're a mother or a father, or an aunt or an uncle. Yeah, it's a worthwhile conversation to have.